Hi guys, so today I'm finished with the avoiding injury series for now anyway, and what I'm going to talk about is nerve pain, um, so how physios can help with that. So a lot of you might have had sciatica, or you might have suffered from shooting pain down your arm, and it's not pleasant. And basically what I'm going to talk about is how a physio can help and what can cause it. So believe it or not, especially for the arms, bad posture can be a serious problem when it comes to nerve pain shooting down your arm. So you kind of become forward like that and your neck starts to go forward. And what happens is your muscles get very tight. The bones kind of are in a position they shouldn't be in. And next thing you know, nerves start getting pinched. And that can cause shooting down pain. Now, it's not going to cause like any long term problems with your nerves other than the fact that there's going to be pain, but it's not pleasant. So you're not going to have any long term problems. But if once you go to a physio, I mean, you're not going to have long term problems. But if you come to a physio, what we can do is we can address the tight muscles and we can address the bad posture, bring you back to what you should be, bring your chin back, and get your muscles nice and loose so that they're not causing a pinch on your nerves, which causes the shooting pain down the arm. We can also show you some techniques that help nerves move more freely in the body, so it's kind of like a flossing technique, and it can just help not help them get uncaught up in the muscles and all that sort of thing. So yeah, that can be a big help. Similarly with sciatica, like sciatica is horrible. It's shooting down your leg. So it's not really often caused by bad posture. It can be sometimes, but a lot of times it's caused by lower back problems, so disc problems, and it can also be caused by tight muscles. Believe it or not, that's kind of the main lower body nerve problem that you'll get is sciatica. So disc problem, what can happen is that basically the disc will bulge, like I've discussed before in videos, and it can basically hit off the nerve and send these horrible shoots of pain down the leg, and it's just not pleasant at all. But what we can do is we can help relax the disc, get the nerve, kind of get you moving again, get you more confident in moving again, which will help the disc to go back in, and it'll just help you with pain, and also get the nerve, so it'll help with tight muscles that are causing this disc to go out as well, and just calm everything down and help the nerve be less irritated and move more freely in the body. Similarly, sciatica can be caused, believe it or not, by there's this muscle called the piriformis. It's underneath your glutes, so it's quite deep in there. And what it can do is it can basically the sciatic nerve will either go over this muscle, which is great. Not a lot of people have this, but most of the time what will happen is it'll either go through the muscle. So imagine this is this piriformis muscle, that's your sciatic nerve going right through it, and then it can also go under it, so that can also impinge the nerve. So that can cause awful problems. If this muscle gets tight, it can cause horrible shooting pain down the leg and give you all sorts of horrible problems, thinking that you've really serious problems when in fact it's just a tight muscle in your bum. So we can help with that. So dry needling is unbelievably helpful for that, because it's, like I said, it's a deep muscle. It's not always easy to get with massage, so the dry needling can really help get to it easily enough. So like, even if you're not comfortable with needles, guys, I mean, the needles, I'm not even joking, are the same size as my strand of hair, and I have fine hair. But yeah, it's just very good for it. So yeah, basically just kind of letting you know, just because you've nerve pain, going to the doctor can help. And if you've never had something like this before, I would recommend going to the doctor. And if that helps, great. A lot of the time it won't, because what they'll do is they'll give you something that will basically address the pain you're having, but it doesn't address the problem. So therefore, if the problem is still there when the drugs wear off, it will still bother you basically. So like, basically anti-inflammatories and painkillers aren't going to stop muscles being tight, and they're not going to help with bad posture. So that's where we come in. So yes, if you are in pain, you've never had this pain before, by all means go to the doctor. Or if you're in pain and you've had this pain before but it's killing you, go to the doctor. But there are times when you need to come to the physio, because the doctor won't be qualified to give you the exercises necessary or give you the treatment necessary to recover fully. So yeah, if you are having any sort of upper body nerve problems or lower body nerve problems, guys, don't hesitate to get in contact with me. You can be helped, believe it or not, and it can make your life so much easier. I hope you enjoyed the video, guys, and thanks for watching. I'll see you then. Bye bye.